Growing up, my dad was a doctor. He was an OBGYN, and so I remember him waking up early. I'd hear the garage door open at all times of the morning, leaving, going to help somebody bring a new life into the world. And so I don't really ever remember a time when I decided I wanted to become a doctor. When I was very young, I wanted to save all the animals. And by the time I got into high school and college, I already knew I wanted to go into medicine, but I wasn't quite sure what kind of medicine I wanted to do. But there was never any moment that I can tell somebody where I just said, you know what, now I want to be a doctor. It just always was that way, probably just for me emulating my father as he would go take care of patients and talk about patients when he came home. So it was just a natural transition for me to go from trying to save the animals to trying to help people and become a physician. When I first went into medical school, I was 100% certain I was going to be an orthopedic surgeon. I wanted to fix bones. My ambition was to go help athletes become better athletes, and maybe become part of a professional team or follow a professional cycling team, which was one of my passions growing up. And then one day, I didn't have much to do during my general surgery rotation, and I saw someone having eye surgery, and I walked into the room and I asked the surgeon, hey, do you mind if I join you on your surgery? He said, sure, sit down, and was absolutely blown away by what was going on in that operating room. It was actually a retina surgery that I was watching, and the guy's still practicing up in central New Jersey. But I'm sure he has no idea to this day that just me watching him do that surgery completely changed my career choice in medicine from orthopedic surgery to ophthalmology. I just thought it was fantastic surgery and had a huge impact on patients' lives. Cornea anterior segment refractive surgery is a really broad category in ophthalmology. It's really surgery on the front of the eye. And as a resident, seeing the different surgeries, I had an attending who I had a lot of respect for, who was kind of enthusiastic about fixing things. And I really wanted to do that. I thought that I'd be able to bring some skill with me into residency, and wanted to help people who had problems that other people didn't really want to fix. And cornea external disease refractive surgery kind of fit that bill, where it's such a broad category. We can do everything from cataract surgery, complex cataract surgery, anterior segment repair, which is one of my personal loves, corneal transplants, and in a short amount of time, an hour, 2 hours, 15 minutes in some cases, you can take somebody who thought they had a problem that had no solution, and you can give them good vision. So for whatever the reasons are, I was very much attracted to anterior segment surgery, and to get where I wanted to be, I chose the cornea pathway. So my particular niche interest is in anterior segment reconstruction. And so what is that? There's no such thing as the anterior segment of the eye, but it's basically the front of the eye. And my personal favorite thing to do is have somebody come in to see me who has had problems, whether it's trauma, problems with another surgery, genetic malformations, whatever it is, who was seen by other ophthalmologists and said, you know what, this is not something that we're able to fix or repair. And then they can come see us and we can say, you know what, there is a solution. Most people don't know about it, but we've got a technique, we've got a device, we've got some kind of a solution for you. So it's not hopeless. We're going to take this issue and we're going to try our absolute best to remedy it and give you good vision again and make you happier. Will's Eye is the best place to be. It's growing up, I grew up just outside Philadelphia. I'd grown up hearing about Will's Eye. I had interviewed here. I did rotations here at Will's Eye as a medical student and resident. And it's the collection of the best people in ophthalmology. And why would you not want to associate yourself with that group of people? You don't have much spare time, so you got to make good use of it when you get it. And I love to be outside. I don't live in the city. I work in the city, but I live outside the city. So I love spending time with my family, doing things outdoors. We love to ski. I used to race bicycles, so I still try and pretend I'm a good cyclist. So every moment I can, I get back on my bike or I go running. Sometimes it's early morning, sometimes it's late at night, sometimes it's in the snow. But any moment that I'm not here working on eyeballs, I try and spend that time with family or staying physically fit.